Recognize the gentlelady from California, Ms. Capps, 5 minutes for questions.
Thank you, Mr. Chairman. Commissioner Taylor, I thank you for your testimony, and I'm glad to be here today ensuring that the Food Safety Modernization Act is and continues to be as effective as possible. I understand that the FDA faces immense scope of responsibility in implementing the Food Safety Modernization Act. You mentioned that FSMA will only be as effective as its on-the-ground implementation lets it be. And I agree. Agriculture is one of the primary economic drivers in my district, and so these issues certainly hit close to home. Food safety for fresh produce, such as leafy greens, is obviously incredibly important. As you may know, following an earlier food safety crisis in 2007, California leafy green growers, many of them are in my congressional district, took it upon themselves to raise the industry safety bar by creating the California Leafy Green Products Handler Market Agreement, a mouthful, LGMA for short. Since its founding, LGMA has become a strong collaboration between government and farming communities. They incorporate science-based food safety practices and mandatory government inspections in an effort to ensure safe leafy green products. The LGMA has already been, for all intents and purposes, verifying the leafy green industry's compliance with food safety practices that meet or exceed the specific rules being proposed under FSMA. Obviously, we all want to make the process as efficient and effective as possible, ensuring high standards without creating unnecessary redundancies. I just met with the California Farm Bureau folks, a couple from my district, just now. This is very much on their mind. Yeah. So my question to you, can you tell me what the agency is doing to collaborate with groups like LGMA in this process? How will FDA work with industry to verify compliance with the new FSMA laws?
Yeah. Well, thanks very much for the question. The Leafy Green Marketing Agreement is a real demonstration of leadership on the part of that industry,
yes,
which has come about in response to some of the outbreaks that were very costly and disruptive for that industry. And the standards that they have put in place and that they monitor themselves are very positive and are standards that, as you say, will likely meet or exceed, what the federal standards will be. And we certainly, as we think about how we verify compliance with this broad range of standards, absolutely want to cooperate with and place reliance where appropriate on these private efforts to monitor and verify and demonstrate that their product is being produced in accordance with these standards. So we collaborate with the folks involved in the Leafy Green Marketing Agreement. It's a very positive part of progress on food safety, so we embrace it.
So it's not like one person has the rules and the other person is trying to comply, but you are all in it together.
The enormous dialogue and recognizing that we want to capitalize on what people, leaders in the industry have learned and then again, not disrupt those practices that are working, just,
right,
out of some, yes.
Let me just push this a little further. Not that I don't disagree with what you're saying, but as you know, unfortunately, contamination in our food supply repeatedly has threatened the health of Americans over the years, and you mentioned how costly it is to the industry as well. These events have really initiated such fear in consumers concerning the safety of our food supply, the very food that is the best health best for us. So we need more of a win-win. And I think that's behind this effort here, bipartisan effort to enact the Food Safety Modernization Act. Now, several years post-enactment, how have we become more prepared? Do you think we are in a position where we could not just prevent but anticipate the next big outbreak? How will the FDA be more effective in dealing with the next big food contamination emergency?
Well, I think there are a couple things I mentioned already that I think the FSMA is part of a process and where we've been making progress in the private sector and through collaboration between government and private sector to put in place practices even as we anticipate FSMA being implemented, and that's one way in which I think we're hopefully making progress. We have also done a lot of work at FDA and with the CDC to be better at detecting outbreaks earlier. We've created a focused, specialized team at FDA to do early detection of potential outbreaks, to respond more quickly, and then importantly to learn from outbreaks. And so we've investigated, for example, the cantaloupe outbreak that killed 33 people associated with listeria and cantaloupe. We did an investigation of what the potential cause was, and then we've been out collecting additional data to inform the cantaloupe industry about measures that can and should be taken. So there's a lot of work going on. and again, which will continue even as we get the regulations in place and are able to verify that the practices that we're learning work are in fact being implemented comprehensively, not just by the leaders, but comprehensively across the system.
Okay, great. I'll yield back.